of access and affordability to health care. Because many would say that if you don't have your health, you have nothing. And if you've ever been through a sickness or an illness or a disease, or just even sprained your back for a couple of days, you really begin to, or as you get old, you really begin to understand just how much you should value good health. And of course, a lot of us, it's hard to be healthy because it means you have to eat well, you have to exercise, you have to exercise that mental piece because the mental and the physical go together, etc. It's hard. There's a lot of things that we could do to make ourselves healthier. It's good habits versus bad habits, and of course it's always easier to eat potato chips than it is to eat broccoli for most of us. But the reality is, most people believe that in an industrialized, wealthy nation like the United States, the wealthiest nation that the world has ever seen, that somehow or another we should all have access and affordability to health care. That instead of it being something on a menu to choose from, that it should be given in our country. That if you need access to health care, it should be there. There are many people in our nation who believe that. That's not the way our system works here in the United States. And many of you know that. How many of you have no health care? Right? 4 people, 60,000, housing costs. And you're working, and you're bringing home, you're making 60,000. That doesn't mean you're bringing home 60,000, but you're making 60,000. And you gotta rent, gas, car, kids' costs of going to school, even if they're going to public school, you know what that is. This, that, nap pack, you know, lunches, whatever. And your employer tells you, I can give you health insurance, but for your family it's going to cost you $350 a month. You think you can afford that? The answer is no. But this program affords the availability to cover your children. It doesn't cover you, but it covers your children for preventive and some basic and actually some pretty good coverage. And this is what we put in. It came up for reauthorization. What does that mean? Every 5 years, usually we put in a bill or a program for a 5-year period. And what the Congress does after that is we bring it up and we re-look at the program. Because a lot of things can change in 5 years. Imagine if you had a program where you were using calculators in the classroom, but 5 years later you're using personal computers. You know, you wouldn't put in a program for calculators and fund calculators for 50 years in your school. You would say, I want to look at it every so often and see if there's new technology or new ways to do it, or if kids are really using that to help them in the classroom. It's the same thing when we do a program. So we did this SHIP program. We're at the and we're past the reauthorization point. This year we said we need to cover